Welcome to my YouTube channel where we will be talking about survival medicine. We'll be talking about different scenarios, trauma, different medical conditions, and what you can do in life-threatening, limb-threatening situations until medical help arrives or until you can get yourself to the right medical help. This channel is about speaking to you about survival medicine. And that's what this is. And that's why it is not medical advice. It is just surviving until you get the proper care. If you found yourself in one of these two scenarios, stabbed or possibly shot, what would you do? Panic, pull out the knife in the case of a stab wound, or just wait it off until you die? While I'm a fully qualified doctor working in the accident and emergency department, I'm not here to give you medical advice. If you do get shot or get stabbed, call 999, call your emergency services, and get to the hospital. What I'm here to talk to you about is what to do while you wait until help arrives. A penetrating injury, like a gunshot, a stab wound, could definitely kill you. But the question is, how fast? Despite working in a fully staffed, fully resourced accident and emergency department, we rely on two key things: a proper coordinated teamwork and application of resources. The fluidity of these two things buys us the time we need, because in every emergency, time is the enemy. The stab wound doesn't matter, big, small, or gunshot as it may be, very deep, very superficial, through and through. Same. Time is of the essence. If you find yourself in that scenario, you've called for help, the ambulance is on the way. While you wait, or while you're being transported to the hospital, especially if not by an ambulance, what can you do? Well, the option definitely is not to pull out whatever object has been used to stab you. If it's left in place, leave it on there. Well, the reason I said do not pull out the object is simple. Because the object might be providing the tamponade. In simple terms, might be providing the occlusion or might be stopping the bleeding we've talked about you trying to stop. And so pulling out the object and make things 10 times worse. But say the object was pulled out, what else can you do then? Well, the first thing you want to do is keep calm. What's the worst that can happen? Death. Well, that's definitely gonna happen if you panic. Keeping calm gives you an option. Keeping calm allows you to use some extra bit of time that would potentially save your life. And what does keeping calm mean? It doesn't mean sit back and wail. It doesn't mean sit back and do nothing. Keeping calm means if you've been stabbed and the object, whatever it is not in the body, so it's been stabbed and taken out, what you can do is look at the area. Just keep calm. Sometimes, if you're lucky, you would see the bleeding source. If you're able to see where it's bleeding from, apply pressure. If you can't see it, but there's a hole and it's bleeding, apply pressure. Now, there are a number of ways to do that. First will be applying pressure as hard as you can, but there's only so much your hand can do. So, if you've not been walking around naked and you've got clothes on, so rip them off and use them to block the puncture sites. Firmly push hard as you can. And observe, if it seems to still be bleeding, if you can get someone to help you hold, get someone to help you do the pushing and the holding. But if you're by yourself, then by all means, remember, you're fighting for time. Infections are a huge possibility, but infections don't matter if you're dead. In a scenario where you've got Vaseline, good old petroleum jelly, rub it over the area and still occlude the area. The Vaseline could provide a layer that would also help achieve the hemostasis you're trying to achieve. That's the first thing. Now, this is mostly for torso, neck areas. If you've been stabbed in the extremities, so your hands, your legs, it could still be potentially life-threatening, especially if a big vessel has been nicked. Same thing applies. Occlude the area firmly. If you're not able to achieve good control of the bleeding with that, then go a few inches above the area and tie. If you have a belt on, use the belt. If you don't have a belt, anything you have, anything you can find, a rag, a piece of cloth, rope, anything you can lay your hands on. Tie until you feel the limb going numb, until you feel the blood clot being cut off, because that's what you're trying to achieve. And that's why at the start of this video, I said do not panic, because panicking will only make things worse. I remember, see if you can find the bleeding source. If you can't find the bleeding source, that's fine. Just get everything and anything you can into the area the bleeding is coming from and try to stop the bleeding. So this is not health advice. So don't do this and say you're fine. Do this until you get to the hospital. That is what this is. Do this until the ambulance arrives, because time is of the essence. If you like contents like this, then stay on and watch out for more videos. Thanks for watching.